Hi everybody, Dr. Sia here from the Dr. Sia channel. In the video here today, which is part of a video series on attachment, we're going to be talking about avoidant attachment. Let's get started. Alright, so let's start talking about avoidant attachment. First of all, to understand what avoidant attachment is, we have to understand what attachment is in general. In short, you can look at attachment this way. What does a child do when they feel emotional hurt or pain? When a child is securely attached, when they feel emotional pain, they will be able to soothe themselves. They will look for other people to come close. They'll grab their parents, they'll grab their caretakers, they'll grab their friends, and they'll say, help me overcome this difficult time. I can do it within myself, and I can do it with you too. And if you come in, if you try to help me, it doesn't interrupt, it doesn't sort of get in the way in any way. I can help me and be helped by you at the same time. What might this look like? For a secure attached person, it might look like if they're, for example, experiencing loss, they might be able to cry with a friend who's soothing them, saying, there, it's fine, and they're crying at the same time. They're soothing within themselves, and they're also being helped externally. So then with avoidant attachment, the primary issue is that with avoidant attachment, when you are hurt, you don't think that other people can help you soothe. You think that because of this really horrific and continuous and repeated childhood criticism, childhood neglect, childhood issues that you've had where your parents were not soothing, you will then think, when you have avoidant attachment, that other people cannot be soothing for you. So if we look at that child, whenever they've been hurt or sad, they would have walked up to their parents and cried. Their parents might have, for example, said, oh, stop crying. You're being so bothersome right now. Or can you just cry in your room or something instead? Or, crying is for babies, right? Because that person has had so many experiences like that, in their childhood, they've learned that when they are sad or if there's anything going on with them, they have to withdraw. Now, when we look at adult avoidant attachment, it's the same thing. They have learned that as soon as something goes on inside, whether it's sadness or anger or indeed sometimes even positive things, they have to pull away from people. They have to get away from everybody. Because the only person who can help them is themselves. And therein comes the avoidant bit. So then they avoid people as best they can so that they do not bother anyone or get criticized by anyone because of the experiences that they have inside, because of the hurt and the pain that they have inside. This is one of the most critically missed informations out there. When I see YouTube clips, when I watch information, when I even read articles, I find they don't really qualify, they don't explain when attachments truly trigger in, and an avoidant attachment really triggers in when it comes about noticing the negative stuff inside. So what happens is, as soon as the person notices something negative inside, they pull away, they hide away, and then they sort of fix themselves, and then they can come out. Now, another thing that happens is an avoidant attachment person, a person who has an avoidant attachment, is also very unlikely to be able to notice things inside of themselves. Because not only do they need to pull away from people and then sort of heal, they don't really heal, but they sort of until everything calms down, they also need to not notice things happening inside of themselves so that they can come back out of their shell again. So with avoidant attachment, there's a lot of misunderstanding. People think that avoidant attachment is that you sort of know everything that's happening inside of you, but you just don't want to share it. That's not true. What happens for a person with avoidant attachment is that they go inside a shell when they're hurt, and in that shell, They experience very little. They understand very little of what actually is happening. For an avoidant attachment person, they go inside a little shell, and then in that shell, everything just goes down. Everything, their insight just goes down, their noticing goes down. For an avoidant attachment person, when you ask them how they truly feel about something negatively, when they have a negative experience, their most likely response will be, I don't know. And that's true. They genuinely don't know, because they genuinely have learned not to look, not to see, not to observe themselves, pull away, not to connect with other people. That's been the only thing that's kept them safe. And that is, in essence, what avoidant attachment is. It's to look away from everything that happens inside. It's to look away from everyone around who's trying to help. Now, a lot of people ask me, how come we can have an avoidant attachment for so long and not have any positive experiences in our life change that? I mean, yeah, your first 5 years of life were hypercritical, but how come your subsequent 50 years of positive experiences and the potential for positive experiences hasn't changed that? Well, here's another thing that they never tell you in the articles, they never tell you on YouTube, probably because they don't know, is because the way our brain works is that once we have a certain attachment, once our brain starts functioning in a way, in a certain attachment, all of the information that we get just goes to confirm that attachment. Any new experiences, they don't get remembered. What we say is they don't get encoded in long-term memory. So what does that mean? When a person comes up to you and they're trying to be really nice to you, even though you had that experience of a person being really nice to you, that sort of goes forgotten. That goes somewhere else. That goes away. Rather, what you'll remember after 10 people were really nice to you, what you'll remember is that one person who was really overly critical of you. So I'm a lecturer, and sometimes I have 300, 400, 500 students sitting in a lecture in one go, and some part of me, if I had an avoidant attachment, would make me focus on that one person who's being really hypercritical, sitting there going, I don't believe a word you're saying, rather than seeing the 400, 500 other students who are sitting there going, wow, this is so interesting. So our minds get biased in that way. So even though this person, after 55 years of life, have had a mix of both positive and negative experiences when it comes to criticism, what they really remember, what keeps them safe, is that stuff around staying away from hypercritical people. So this is one way that avoidant attachment affects us in our lives, is it keeps this pattern going over and over and over and over again. People are overly critical of me, I must stay away. If I'm hurt somehow, I can't see what happens inside me. I'm not allowed to see that because that's always been bothersome to everybody. So I can't see that. And I also can't see that there's any potential for help of anybody around me either. In essence, what we've talked about today are two main things with avoidant attachment that I just want you to remember. And I'm happy to talk about attachment a lot more. I can talk about it forever. It's this. When a person has an avoidant attachment, when they are feeling hurt, they go away from themselves, they sort of block their own experiences out, and they block people out. They go away, they tend to get depressed, and they come back out when they sort of think that they're not going to bother anyone, including themselves again. And another thing is why the attachment doesn't go away and why it stays there is because new and positive experiences don't tend to get encoded in their long-term memory. So it happens and then it just disappears. After a while, it's just not there anymore. Now, there's some positive news, and that's that with therapy, for example, a therapy like intensive short-term dynamic psychotherapy, ISTDP, it's focused on our attachment. It's focused on how we tend to behave according to our attachments, how we tend to engage in those avoidant patterns, in those avoidant attachment patterns. And it helps us see and encode in long-term memory those positive experiences that we're having. And it helps us also encode in our long-term memory the behaviors we're engaging in that perhaps were there to protect our parents when we were children, or even serve to protect us when we were children, but don't serve us well anymore. So yes, life is very difficult for a person with avoidant attachment, but it's not too late to do anything about it. I've had patients who are 75 years old who come in and say, look, it's not too late. I want to work on myself. We've identified that they've had an avoidant attachment their whole life. They make a change and they start experiencing life as a lot more flourishing, positive, and grateful experience. So if you want to know more about attachment, if you want to know more about what we can do about attachment, let me know in the comments below. Subscribe to this channel, please. It really helps the channel. And, press that bell button so you get these updates. And yeah, that's all I have for this time. It's doom and gloom out there today, people. Corona is affecting everybody. We need to really come together right now. And if you know a friend who does have avoidant attachment, who is isolating themselves, not because of Corona, but because of their emotional difficulties, don't feel afraid to reach out to that person and help them out. Even though they might push you away, deep down inside, there's this part of them that just really wants, deep down inside, to be taken care of and be loved, just like the rest of us. That's for me for now. I'll see you next time.